Hello, this is Curtis Jensen. I am reporting on patient Ima Wheezy. So just to give you a quick situation, Ima Wheezy is 85 years old. She's a female. Her code status is do not resuscitate. She says she's allergic to aspirin. She says it gives her a stomach ache. She presented with pneumonia. Her daily weight is 175. Um, Currently, she's not really tolerating activity, and she hasn't really tolerated activity since she came into the ER, just because of shortness of breath and things like that. She is currently on VT precautions. She's receiving heparin at this time. Background and assessment. So the patient came into the ED with complaints of shortness of breath. She was diagnosed with pneumonia. Has been experiencing AFib and has had signs and symptoms of possible heart failure with generalized edema, 3+ pitting in the ankles, and just generalized her body. She has had some pulmonary edema, possibly, and pulmonary congestion from the pneumonia with crackles in both lungs over the mid and lower fields. She's been taking Rocephin for that. She also has been taking Colace for digestive issues and also for the fact that she's been immobile. Let's see. So she was on a nasal cannula at 4 liters, but due to the pulmonary embolus that she experienced and her pretty low O2, it dropped from 92 to about 85. We did up her O2 to a non-rebreather at 15 liters. We also gave her an albuterol breathing treatment for that. Her heart rate has been around 92 to 93. It did rise to about 108, 110 during her kind of chest pain that she was experiencing. Blood pressure was around 140 to 150 and over 82 to 87, and it spiked to 162 over 94. And she was experiencing some pretty severe chest pain. We gave her 3 nitro tablets with no relief and 2 grams of morphine IV push, no relief for that as well. She still complained of chest pain and shortness of breath. We administered 5,000 units of heparin, and we were ordered to administer 5,000 additional units of heparin to help with the chest pain that she was experiencing, help with any clotting that was going on. We also administered 40 milligrams of Lasix, and she only voided 600 milliliters in the ED yesterday, and she's voided 75 milliliters of dark concentrated urine in her Foley that we placed today for us. So she is definitely going to want to be on Lasix. Bowel sounds present ×4, alert and oriented ×4. Labs, white blood cells, she's sitting around 12 right now. Red blood cells is about 3.53, so that's low. White blood cells are elevated. Her hemoglobin is 9.3, hematocrit 28.9. Her prothrombin time is 38.5, so it was low, especially for her receiving heparin. She wasn't therapeutic. Her sodium is 123 and her potassium is 3.6. And I would just recommend continuation of the heparin, possibly starting the patient on a thrombolytic, maybe alteplase or any kind of thrombolytic that will help bust up that clot. Placement of SCDs and TED hose, keeping patient oxygenated above 92. So continue with the albuterol treatments and continue with her nasal cannula. Maybe possibly move up if she's still not breathing very well and still not oxygenating. Continuous monitoring of her ECG, or continuous ECG monitoring, chest CT/X-ray, possibly a BNP to assess for signs and symptoms of heart failure.